Behind most changes it's basically a balance. On the one hand, what is very important is that cost increases very rapidly, 20–30% a year. So obviously that means that something has to be done on all these overruns. That's one side, what is important on the changes. And the other side is that what we want to do is filling gaps, is increasing patient responsiveness. And if you want to have large patient responsiveness, what you basically have to try to do is, give them much freedom on how to spend the money. The cost increases will become more moderate. That has to be the outcome. Will we succeed in that outcome? Obviously we have to, but history tells us that we will succeed over the short term, but it's still very hard to temper the growth part over the long term. Yes, I think PGB has been a success. It's been very popular among patients, very popular, hugely popular. So that's an indicator of success, I guess. It also has led to much innovation, to much more new small enterprises entering the market. So I think that's, you can say that's a success also. And finally, it has filled all kind of gaps which were not covered or are not covered by the normal professional healthcare system. And so I think, there are good reasons to say it's a success. But of course, this success comes at a price. Obviously, there is actually only one large drawback, and that is that the cost inflation runs so rapid, so high. So that's, I think, if just look at it practically, that's the major drawback. There are other kind of drawbacks, of course. Sometimes it is also said that you can better monitor quality regulations with professional care than if you go to the PGB. Then it's much harder, for example, for the health inspectorate to check and to monitor if quality regulations do comply. There will be budgetary pressure on the scheme, and this might, actually become more intense in the next couple of years. I think it's very hard for a government, to keep on running a program which increases 20–30% a year.